Yeah, and I even hear clinicians talk. A lot of clinicians don't know. Like a lot of clinicians don't even know about pharmacy benefit managers. The only reason I know is because I've been in every aspect of this business, and then I would get into it and I go, oh God, that's why that was happening. Okay, now I get it. Now I get the magic trick. I understand what you're doing here, how you're moving and shifting profits and monetizing disease states. So think about this. If I can monetize your diabetes, why would I cure or prevent your diabetes, right? And I know if I'm a bigwig at United or Cigna, that you're going to switch jobs in 3 years, and by the time that diabetes leads to metabolic disease and a cascade effect that puts you in a hospital that costs me more money, you're somebody else's problem. Or if I can stall it long enough, you're the federal government's problem. And so every aspect of healthcare is focused on that quarter, on that time frame. Another terrible example of surgery, and this is honest to God. I talked to my buddy who's a president at an orthopedic company. He told me he was sitting down with a surgery center about joints. And there's a new joint that they have, and it's more expensive, but the efficacy data of the long-term benefits on it astronomically outperform the other joint that this hospital system was using. He sat down with the CEO of the hospital, and he said, here's the data, 5 years out, here's what we're seeing, da-da-da-da-da. The CEO said, I don't give a shit what happens 5 years out. Swear to God, this is a call I had yesterday. He said he looked me in the eye, Brigham, and he said, if you told me that this joint will last at least 90 days and it's cheaper, that's all I care about.
Oh my
Because
God.
all of their data and records and accountability are only on the first 90 days. Once you're out of that 90 day and you've done your little review and all that, you're off again and you're no longer a monetizable patient. And so too, when we talk about primary cares and what's happened, the same thing with pharmacies where they've been gobbled up by insurance companies, if they're in the insurance model, is the same thing that happened with primary care practices. The day of a primary care being independent and a free thinker is over.